Hello, my name is Gasia Mikaelian. I'm an anchor reporter at KTVU Fox 2 News in the San Francisco Bay Area. I am so happy to welcome a familiar voice into this conversation about the coronavirus pandemic. Welcome again to you, Dr. Vanila Singh. You're the former Chief Medical Officer at the Department of Health and Human Services. You're also a longtime clinical professor at the Stanford School of Medicine. Thank you again for being with us.
Thank you. Great to be back.
Let's start, Dr. Singh, with the recommendation that many people in our home state of California and elsewhere are now hearing for the first time. And that is that anybody and everybody should be wearing a face mask, not an N95 specifically, but even a bandana can do. Why the recommendation now? It seems to be a changing of the course from what we were hearing just a week ago.
Yeah, so important a point because this is the latest recommendation to have folks utilize really almost any face covering for the mouth and nose. And that really, I believe, goes to the fact that they're perhaps it's a fluid situation, and they're learning, of course, that there are people who don't know that they have the virus, maybe asymptomatic or have mild symptoms. But I think also goes to the fact that when you go to a grocery store, anywhere that's essential, you may not be able to have the 6 feet of social distancing that you may like. This is just another means to ensure that that spread does not happen inadvertently. So it's not to substitute for social distancing, but it's really to ensure that whether you're aware or not, and you come within the 6 feet, that you are protecting yourself and, more importantly, those around you.
So is it equal parts me keeping in whatever I have and keeping out what the other guy may be, given to me?
I think it's even more so protecting others from you more than anything. And in another way, it is protecting you in the sense that we know inadvertently in all this crisis, we've learned how often we are subconsciously or consciously touching our face. And so this is another way to prevent that. So it's really both. And just think of it as being a good neighbor and good community member.
I went to the grocery store for the first time since the statewide recommendation came out here in California. I had my mask with me. I'll be honest, I felt a little foolish putting it on in the parking lot, but I thought, you know what? I have a family to protect, so let me take it with me. And once I got to the doors, I thought, all right, here we go. And I put it on, and it felt weird. It felt really weird. But I told myself, the advice that another doctor gave me recently, if it feels weird, that means you're doing it right, because we should be out of our comfort zones, because this is strange and new.
So true. And I think most people probably can relate to that. I certainly can. I also went to the grocery store and I saw more people than usual after this recommendation. It's not a requirement, but recommendation came out from the CDC and our state public health officials. And I agree with you. I think it does not feel right, but maybe we all feel like we're doing something. And that may make us feel more reassured that we feel like we're doing something. So I agree with you. We should all feel a little bit of discomfort.
Let's talk about a phrase that first sort of popped up in our vocabulary a couple of weeks ago: flatten the curve. We had medical professionals urging us to take action now to help mitigate the severity of the coronavirus pandemic in the United States. Have we in fact flattened the curve?
So the early indications, even from New York City and the rate of deaths, seems to be indicating that certainly even in our hotspot peak area, that there is some indication that that's working. And certainly if you look at California and even better Washington State, it is clear that the early concerns, the modeling that are there have not panned out, which is excellent news. And it only goes to show that we have to continue to do our part so that we can get the hotspots that are there now and the emerging hotspots, for example, Miami or even Los Angeles.
I know that you're not directly involved with federal health guidelines. It was less than a year ago that you left the federal government. But I have to ask you, some people are second guessing what we have or haven't been doing for the past month or so, saying, oh, now we say everyone should be wearing masks. Where was that recommendation a month ago? Oh, now we're all being told to stay home unless you have to go out to get groceries or medicine. We could have been doing this for the past month or more.
You know, what I would say is that there are so many considerations to be had when you're making these recommendations. Number one, we know that this immediately affects people's livelihood. So it's really about an underreaction versus an overreaction. We're also learning about the characteristics of the virus. What is it affecting? Who is at risk? And are there other factors that are playing a role? This virus is new to our society, to the human race, actually, and it is something that is proving to be different than even its own cousins or family members in the coronavirus family. So this is one important thing. The other thing is that early on, we knew those masks really needed to be with healthcare workers. And we knew also that there was a likelihood that there's going to be great shortages in some places. So the early signs were really more about ensuring that the healthcare workers had it. We cannot have our healthcare workforce get sick. That would be doubly devastating. And it's also about understanding what's just the right real important measures to take to ensure that we're not overreacting or underreacting, because all have consequences.
It seems, Dr. Singh, that so much has changed in the time since coronavirus became a part of our vocabulary. I can remember a time not that long ago where, active, healthy 30-somethings were saying, you know what, even if I get it, I probably won't die from it. And there was also the idea that children specifically were in some ways almost immune to coronavirus. Those two ideas have been turned on their heads.
That's absolutely right. I mean, I think the sense of invincibility from young folks is natural, but it's also hopefully a lesson learned for going forward, that we all have a major role to play in this. Vector transmission through the young, whether it's in schools or those who are older on spring break and on the beaches, having to understand that we all play a role in this society, that we are connected because we're social creatures. I think that's a major, major lesson that we've learned. Also, we're learning about the virus itself. I think at the end of this, as we take serology tests, blood tests, understanding how it came into being, when did it start circulating, and are there other factors that play a role in who may succumb to this disease that is often devastating for some. But the most important thing is that we are actually here at the challenge, and my hope is that where we're hearing about these flattened peaks potentially showcases that we perhaps did the right things.
Let's talk about, I know you've done extensive work in the fields of molecular and cellular biology. Where do efforts stand right now for a vaccine? And then later I'll ask you about a treatment for coronavirus.
Great. So the vaccine is a really important aspect of this. I think once we have a vaccine for this virus in particular, we'll feel much more at ease, because we know we can give that vaccine and stimulate an immune response, which is a defense system, to the virus, especially for those who are vulnerable and at high risk. Because we don't have that yet, there's a sense of vulnerability that goes across the entire world. And so many of the vaccine trials have happened in record pace. The first one that really came to being, that was reported a couple of weeks ago, is one that was done by Moderna. This is a company that began to do some work on the SARS original virus. And they shelved it because the virus went away from the human race, but brought out their know-how. And by some support with NIH, and specifically NIAID, which is what Dr. Fauci heads, that part of NIH, they began their vaccination trials, and that was in a record pace of 66 days from the virus being coded and the mRNA sequence being known to the first vaccination trial. There are others, many others. Another one I would mention is a US-based company called Altimmune that is developing an intranasal vaccination, as well as others that are taking a protein load into our host human cells and causing a response. Again, this is all about developing our defenses. When we get vaccinations in general, be it to any infectious organism, what we're doing is we are ensuring that if and when that virus circulates or that bacteria circulates, our body defense is ready to go and fight it off. And it really gives that extra boost that the high risk especially need.
We've now heard stories from people who had the coronavirus and have recovered from it. Do we know for sure if someone has had it once, they can or cannot get it again?
Well, it's such a great, important point. I think some of that would depend on something called the genetic drift of the virus itself, meaning how fast it has mutations, and are those mutations in its genetic code significant? Does it change the nature of the virus significantly? If it doesn't, then it's likely the immunity you have can fight off that virus, even if it has a slight mutation. And by the way, there is some mutational changes that are found, but seem not to change the character of the virus just yet. But that's the key point. And there's always discussion every year when it comes to flu season that people feel like, geez, the flu vaccine, does it work? I still get sick. But it may be attenuating it. It may not even be the influenza virus that we're getting when we get sick. So, but that kind of gives you a sense of what we're looking for in terms of getting immunity and keeping immunity. And, it's a big work and job for the scientists to really watch that virus. What's the current strain? So my hope is, at least for now, folks who are conferred immunity can stay immune long enough for us to really get a handle of this through therapeutics and other means.
I know that people who've had the coronavirus and recovered from it are being urged to donate plasma. What happens with that donated plasma? And how does that work?
It's such a great question, and something exciting that's going on right now. So really, when someone gets the virus and recovers from it, more importantly, that showcases that their immune system was naturally able to see the virus and build a defense system and keep that defense system, which is the antibodies that you hear about. Those antibodies are your defense system. And so when we are going in and looking at people's plasma, we're looking for those antibodies. And if we can take those from that person, not all of them, but some of their plasma, the hope and belief, really the idea behind it, and this has been done in the past, so this is not a novel idea, is to take those antibodies and to give it to others who may be currently suffering from the virus, and to either help them have less severity and recover, or maybe perhaps even later down the line, if we can figure out a way where we know people have mild symptoms and maybe even prophylax some of those symptoms that they might develop later. But it's really to fight off those who need the help.
And of course, we're having this discussion about donating plasma at a time when blood banks nationwide are just urging anyone who can give blood to please come and give, because, Dr. Singh, I think about normal life and how that's continuing in the midst of a coronavirus pandemic. So that need for blood, it truly can be the gift of life, especially now.
That is so true. I mean, the American Red Cross, all these blood banks around the nation have seen such a drop, a shortage. And what is really important about your point is that so many people's own medical issues, aside from the virus, continue, and they are urgent, turning sometimes emergent because they're not able to get the care. And we want to remind folks that in this time when you feel sometimes powerless, you can perhaps feel better and empowered, and that you're helping by going to donate blood, but also know that there are people who are still struggling with all their issues there, and maybe even feel more scared and vulnerable. So we have to keep them in our thoughts and prayers too.
And finally, let's take things all the way back to the beginning. I think the first time you and I talked, we talked about, washing your hands, 20 seconds, happy birthday, getting underneath the nails. Now we're in a time of hand washing, plus social distancing, plus face masks, even if you have to go out to the grocery store. I'll ask you, as a doctor and, as a resident of the Bay Area, which is one of the hardest hit areas in the state and the country, is there anything you see when you go about your daily business that either scares you and you think, I can't believe someone is doing that, or you see something and you think, you know what, kudos to that woman, that's a great idea? Is there anything you'd like to share along those lines?
Well, one observation that comes to mind immediately is that when this first started to take place, and my immediate instinct as a physician is really to provide reassurance and calm while ensuring that we remain informed and follow the guidance. I did see some people hoarding at the grocery store. I saw some people kind of really start to think just about themselves. I have really not witnessed that in the last couple of weeks. And I love seeing that, because this is something that we have to fight together, not alone. Even though we are separated socially and physically, we have to fight it together. And as a society, that's how you prevail over this viral illness. And these pandemics in the past, that's hopefully one thing that we know has brought us together, is that really as a human race, worldwide and nationwide, It's going to take all of us doing it for each other and not just ourselves.
I know I heard from the federal government that we're heading into what could be the most difficult, most deadly week Americans have seen as it relates to the coronavirus. What do you think of that assessment?
Well, the lagging indicators, meaning those indicators that include mortality and severe illness, follow down the line kind of the measures that we've already made. So people who already got the virus before our stringent measures of stay home, social distancing, et cetera, were really put into place in most of the country, those people who are now dying were not really reflective of those measures. So that's number one. So when we see the sad, tragic deaths that are coming, it is not to say that our current efforts are not working. Those measures, again, are reflective of likely prior to that. What we are looking for is really new confirmed cases. As we test, however, we expect those new confirmed cases to go up. So it's a hard mixed picture to really see, because some of it is because we are testing more, but really the lagging indicators of mortality rate and severity of diseases hopefully will plateau and start to turn and be a downward slope on the curve that we're looking at. And those are the things that I love people to know, because I don't want people to feel discouraged. I do love it when people know that their efforts are making a big difference, and to stick with them and not to feel a sense of hopelessness, but rather that your efforts are making a difference, and that will showcase in the next couple weeks.
And finally, doctor, is there anything that you would like to say to our viewers that you think is important for us to know on a personal level? I know a lot of people have the deepest respect for Dr. Anthony Fauci, because he really has become a very, he's a leading voice. He's an important voice. He can be something of a reassuring voice as well. Is there anything you would like to say from your doctor's office there at home?
So first of all, yes, Dr. Fauci, who I've met a couple of times, is just exactly who you would expect to be an expert who has so much experience in infectious disease, especially. But from my heart, I would say this, that what I see is that this could have been a much worse outcome if we did not jump on this as early as we did. And yes, sometimes in hindsight, we're going to say what could have been better, what resources do we need, how do we get prepared? But the fluid nature of this and the responsiveness of really a whole of government and whole of society response with our transparent nature in this country is really what gives me a sense of optimism, if you will. It's a cautious optimism that's always that, hey, don't let up, but take heed that yes, those efforts make a difference, and that these are real experts out there, people who are trained in this, understanding mitigation strategy, meaning how do you decrease the risk of the worst case scenario modeling that is done. And we have addressed that from all kinds of means that are actually non-therapeutic in the sense of school closures, community closures, event closures. And then our next step will be to see the medical therapeutics come to play, not just for compassionate use, but rather as part of protocols identifying people who are potentially at risk. And so my view and vision really is that this will get better as some of those clinical trials for therapeutics come into play. It's only going to get better. But our own participation, which goes to all of us, whether you're a patient or a doctor or nurse or anybody, is to continue the social distancing, the use of masks, hand hygiene, and all the good stuff that we have learned, hopefully, are very, very important part of fighting the pandemic.
All right, Dr. Vanila Singh, former Chief Medical Officer at the Department of Health and Human Services, a longtime clinical professor at Stanford School of Medicine in the gorgeous San Francisco Bay Area. Thank you so much for joining us and for your expertise.
Thank you. It was a pleasure.
Of course. And if you'd like any more information on this, you can find it anytime at coronavirusnow.com.